So they'll take a chronic disease and they'll take someone with chronic obstructive pulmonary disease and they'll buddy them up with a new patient who's just been diagnosed. And they'll teach them everything they need to know about their treatment and compliance and inhalers and things. And it's absolutely fascinating. If you buddy up patients with chronic diseases, they both get better. The person who's doing the teaching gets better. They feel a sense of self-worth. And actually their disease outcomes improve. Psychologically they improve. And the person they're training generally trains them better than a doctor and sometimes even a specialist nurse. They treat them how to use inhalers, how to use diabetic stuff. So there's a huge resource out there that we're not using. We're not being innovative about that. And they're there, you know, they're there, they're sitting there lonely, a lot of them sitting on their own. Loneliness is a huge curse. If you can buddy people up, you start doing social prescribing, you do dog walking, you do book groups, you do all these things that are quite hard to prove in really solid evidence-based trials, but you know that actually you need the evidence base for the drugs and then the context and the continuity. If you think about actually what gives us pleasure in our lives, I had this notion that I should rename myself. I shouldn't be a GP, I should be a pleasure coach. I haven't cleared this with the General Medical Council yet, but I think it's an interesting thing that most of the resources in the NHS, in a way, I think goes on us overdoing it. We're overdoing the pleasure. And I think the secret of health is learning how to pleasure yourself in a safe and sustainable way. How many people feel they pleasure themselves safely and sustainably already? How many people feel they could do with a bit of help? I think it's true. I think actually, when I was here last in Wales, the Chief Medical Officer, I don't know if he's here, is he here? No, he's not here. He told me this great story about this concept of crossing the stupid line. It's a really good way of teaching kids. You know, life is full of risks and we need to learn about risks. Medicine is all about balancing quite complex risks. But in just about every scenario, whether it's a professional scenario or it's a social scenario, you can nearly always think of a stupid line, can't you, that you don't want to cross. It could be something about hygiene, it could be something about having a designated driver and then somebody getting a bit pissed and thinking, I know the way home, I'll take over the keys. There's always a stupid line in every disaster that you can spot. In all the whistleblowing stories I've started over the years, there's always a time you can retrospectively go back and think the red flag went up there, the balloon went up there, we should have acted then. Somebody raised concern, somebody said, we're crossing the stupid line, we didn't take concern. So there's the two messages really. There's innovation, proactive innovation, you spotting stuff, and getting in there early to stop disasters happening. And that's what I love about this project. So you see, and that's not right, we'll fix that up, excellent. But there's also a little bit further down the line when shit has happened. When I trained, you never admitted to that. The training mantra was see one, do one, teach one. Have a go first before you ask for help. Incredibly dangerous. When I trained, junior doctors would do major surgery for the first time unsupervised with their consultant not even in the hospital. I can't even tell you how dangerous it was. We're doctors, we can do what we like. But we don't want to swing the other way where doctors don't do anything at all. But also, we need to recognize that what makes medicine unique is not its capacity to do huge good. We know it does huge benefit. It also has capacity to do significant harm. No other industry is like that. If airline industry damaged 1 in 10 patients, every airline would be closed down. That's part of medicine. It's part of the complexity of what we do is we have significant thing to harm people, and we will only get over that if we put our hand up when we've done it. Not in a no-blame culture, in a fair blame culture, because sometimes blame has to be apportioned. If someone's done something that's clearly dangerous, then they need to be held to account. But in a fair blame thing where we learn from it, and that's the bit of the jigsaw I still think is missing.